So these are the questions we're going to focus on today. Two parts. I know those go into other parts, but the one is connective tissue, and that's like injuries and coming back from injuries and how to strengthen that. And then the other is skin. So how would that come into play for somebody that has a bum shoulder and would like to try these peptides?
Peptides are amazing things we talk about all the time, and the different sequences of amino acids make up these peptides. And,
right. All right. Anything you would like to cover outside of connective tissue and skin today? Is there anything? So it seems like that's a lot.
Yeah, that is a lot. I mean, we can talk about those things. If we need to go into something, we'll probably journey through it anyway and talk.
Okay.
Because I mean, if we talk about hair loss or hair growth, that's a show in itself.
So these are the questions we're going to focus on today. Two parts. I know those go into other parts, but the one is connective tissue, and that's like injuries and coming back from injuries and how to strengthen that. And then the other is skin. And a lot of those two coincide with each other, if I'm correct about a lot of this stuff.
Yeah, of course.
So my friend John, who is, would you say the owner, co-owner, this part of the team of the Savage Titan Medical?
So I'm the owner and CEO, the founder of Titan Medical Center. My idea, my concept. I thought we were just going to handle men at one point when we started, and so did my wife, Sharice. Sharice came up as far as when I told her about this, she's like, she's been in the medical field for so many years at that point as a nurse. And, she's like, I don't know about all this. And then when she kind of seen all the research and everything that I showed her, she's like, all right, this is going to be something that people are going to need. And of course, she's my wife. She's the other part owner of Titan Medical Center, and that's my partner. But yeah, I mean, Titan Medical Center, obviously for me, Greek, Titan, blue and white, the colors. That's where it all stemmed from. But yeah, I'm happy to be blessed to be able to do this and help a lot of people out there, including myself. Because that's the basis too, right? You want to help yourself, right, and make sure you're all good and everything's working properly and you're feeling good. So, I am patient zero.
Today's a big one for me too. You say me too on this because skin is such a important thing in my belief.
Yes.
You can have the greatest body, but if you have this extra skin or not quality of skin, then there's issues with that.
Sure.
Will you throw the pipe in there? And then connective tissue is my blessing of the Titan gods in front of us, kind of blessing me with something that has held me together for a long time. And if I can do anything to keep that healthy, then I would like to learn as much as I possibly can.
Sure. I mean, connective tissue is key, right? I mean, all these different little things holding us together, right? And if you can injure yourself and damage yourself in these connective tissue areas as well. So, having connective tissue is key, and there's ways that you can help prevent and strengthen that connective tissue as well. Like we talked about peptides, TB500, BPC157. These are awesome because these will help with the connective tissues. If you have damaged connective tissues, this is something that can help repair those connective tissues too as well. But it's something that you really got to take focus on in your body, and obviously skin. When we talk about skin, everybody wants great skin, right? You want that skin that glows. You don't want wrinkles on your face. You don't want to look like a crocodile, alligator, right? Because you look at some of these people down here in Florida that I come across, and I'm like, wow. I'm like, man, how old are you? And they tell me, and I'm like, man, your skin. I'm like, well, it's really dry. I don't want to insult them, but I'm like, man, do you do anything to to help this right now, or are you just letting it go? And some don't care, right? And some just want to go out in the sun, and they're not wearing suntan lotion. They're not properly hydrating their skin afterwards too as well. And that's kind of where some of the damage comes along. And then on the inside, when we talk about how we wither, right? And because I always give the flower example. We grow, we bloom, we wither, and we die. So that's kind of like the cycle of flowers. So I kind of put us in that cycle. And with that, as we age, all these different things and all our different hormones start to decrease and go deficient. And then when we start talking about growth hormone levels, growth hormone starts decreasing too as well. And all these different things that start decreasing start affecting us on the outside of the body. And skin is one of those things. And you can tell on people's hands too. If they look like they're prematurely aged, you know, those are something you need to look at. You know, it's all about what we do too, as we're maintaining ourselves every single day, like taking a shower, a bath, or whatever it may be, and the products that we're adding to our skin too as well, because these could have an effect on the way it looks and, you know, the way it ages per se, right?
But let me do this then. Let's jump into one aspect, and the one aspect that I hear a lot of is these guys that have the bad shoulders, the bad knees, the bad back, and they've talked about the peptides, and you just mentioned a couple of the peptides. So how would that come into play for somebody that has a bum shoulder and would like to try these peptides? And please explain those two main peptides, right?
Yeah, yes. So BPC 1500, or excuse me, BPC 157. It's more natural to the body than TB 500 is, right? And the aspect that it's isolated from our gastric juices in the body, in the stomach. That's where BPC 157 originates from. So with this, it's great for a couple different things, and this one is more site specific. So with some peptides like TB500, it works synergistically through the body, so all the way through. You can inject in one place, and then you know it's going to make its way around. Where BPC 157 may do it a little bit, but it's more site specific. And
so you're saying if you have a bad shoulder, shoot it into that shoulder.
So I would say not directly into the shoulder itself, but subcutaneously closest to where the area is damaged. So, you know, some people that have had surgeries or even road rash from motorcycle accidents have used this. And of course, you don't want to stick it directly into the surgical site or directly into the road rash, and that's going to hurt a lot. So if you can do it as close as possible subcutaneously, that's going to be the best aspect or way to inject usually with BPC 157. You know, with this, it works not only on, you know, shoulders, you know, ligaments, tendons, like we were talking about connective tissue, muscles, you know, all these different things, even, you know, helping the body heal, whether it be a cut or an opening or after a surgery per se. That's what BPC 157 is really good for. And TB500 works synergistically along with it.
Before we jump on, because I think these are awesome points, because again, he's stating about if you have an injury or an owie, but he's also mentioned that if you gone through surgery and you're recovering, so you're on the mends, this is something that will help mends it along even better.
Sure. The way that these work too, just so everybody knows, is they create new blood vessels to bring blood to the area to help heal the area. That's what it does. So at that point, like that's, you know, when we sustain an injury, usually inflammation happens, blood can't get to that area as good as it should, and the healing process kind of slows down where it's thinking it's healing, right? And that's what it's wanting to do. But at that point, blood flow needs to get to the area to heal the area, and that's exactly what they do.
Nice.
Yeah.
What if you're not injured? Is this something
Great
that's
point.
limited to
Great
somebody
point.
that only has an injury, or can you
No.
use it?
Yeah.
Yeah, that's a great point. That would be again. So we're talking about guys that maybe have injuries or shoulders or operation coming back from. That's I've heard so much about. But it does open up the aspect of somebody that's just aging and says, I would like to maybe strengthen that possibly more than just my nutrition and training.
Yep. So that's a great point too, and it can be used as a preventative. So it can help with strengthening these, you know, connective tissues that you want to not damage. And you know, we're not all blessed like Mike. Most of us have sustained injuries to shoulders, knees, elbows, whether you're an athlete, not an athlete, or you lift weights. I mean, I've got 2 slap tears in my shoulders right now. So at that point, like, I know what it can do. And I literally live on BPC 157 T500. And it's got me through so far on stage 3 slap tears. So, and I can still lift. You know, I'm not going crazy. But at that point, you know, a lot of people have had this damage already. And some people are on the fence if they want to have surgery. And I would say to try this first before you do surgery, because, you know, surgery is going to have you some serious downtime as well. But if you can fix it without surgery, that is awesome, right? And it can give you a lot of relief too, just with inflammation, taking away inflammation in the body. That's another aspect that could damage the body or slow down the healing process. So, that's another good one. It's an anti-inflammation treatment too, as well, for a lot of people out there that want to use it. With these
How long can somebody take this? How is this something that they can take for 8 weeks and then just stop? Or is this something, can they do this yearly?
Yeah, so they can do it. They can do it multiple times in a year if they want to be preventative. If they had injuries, they can use it as much as they really want to try to get past that. Usually we say 10 to 12 weeks, to see some good results and to see, you moving along. It's not going to repair broken bones. I see people touting this thing as like the Wolverine therapy, right?
Right. I see that.
It's like you shoot yourself, a bullet comes out. That's not going to happen. So,
you regenerate through night, you wake up the next day, my arm grew back.
Yeah. So I don't want to put it out there, and I'm not trying to like, oh man, this almighty thing like that. But it's helped so many patients, including myself, with a lot of different aspects of injuries, and it's helped a lot of people get over not having to do surgery, which they thank me big time, because they didn't want the downtime, they didn't want to pay for the surgery and everything that comes along with that. It's always a risk when you go underneath anesthesia, and then you might not wake up too, right? I think about that. I've had surgeries before. It's always caution my ones. You don't think it's going to happen, and it probably is not going to happen. But everything has risk. So the less risk that we have, the better we can keep ourselves, right? So yeah, those two therapies though, they're game changers with patients. Like I said, men or women, because I get that question a lot. If I'm a girl, can I take this? There's no hormones or anything in these products. They're just peptide therapies. So they're more natural to the body as well. I mean, peptides are amazing things, and we talk about them all the time. And the different sequences of amino acids make up these peptides. And,
right.
It's great. I don't know what to say about it. It's really amazing stuff.
No, I agree. You've said so much already, but these are the two things that I do see are really hyped through the internet. And again, a peptide is a breakdown of amino acids.
Yep.
And so it's safe for men and women.
Yep.
And again, I love this aspect because I know that most people stop training not because of a muscle problem, but because of their joints and tendons are causing issues. And so this is great that there's something that's safe that somebody can try to do through Titan Medical. And that's my recommendation, guys. Go over to Titan Medical and talk to them, their wellness provider, about that. If you're thinking about getting a surgery, or if you have an owie, I have people that come in and stay with me at the Titan Castle and do a 4-week training plan and stuff. And we just had somebody here, and that shoulder on this guy is banged up. And I was saying, hey, next week, I want you to go over to Titan Medical and talk to them about trying to get on to something like this, and see if this could help you for right now. Because if you're still training, and like you said, you're still moving through this, and I think your guys' level is pretty high end.
Yes.
So even though you said you're not going crazy, your kind of crazy is not relevant to the other people, because you're pretty psycho.
Right.
I love that.
True statement.
So for you out there, if you do have bad knees, bad shoulders, whatever that risk problem, go over and talk to them at least and get an understanding for it. And then you guys make a decision for yourself. I do want to say to everybody right now, hello to Ireland, the motherland, and to everybody around the world that's tuning in here. To the Philippines, hello. Russia, hello. I love that you guys are here and you're talking. There is a website that you can go to, is Titan Medical. And you can go over there and you could read about a lot of this stuff that we're going to be talking about today. Now, that's connective tissue. Those are just a huge thing on my plate, especially as I get older and older. Now, skin. Let's jump over to the skin. And I know there's a lot of places we can go with this. And I know that a big talk is there's a cream that's out there right now. Now, it's a peptide cream. Can you explain what this is, or is it not a peptide cream? What is it?
So there's multiple peptide combination creams out there. There's anti-aging creams that we do for patients that are prescribed as well. So it can be a combination of different things. So a big one is vitamin C. If you wouldn't believe, that's one that's in a big aspect. There's GHGK. So that's one of the copper one. There's a couple
No,
different.
that's the famous. Is that Jeffrey? That's the one
Yeah.
everybody speaks to. I've had many podcast discussions with these guys that are late 40s, 50s, 60s, and this is the one that they're all talking about.
Yep.
And so they, again, just like the Wolverine kind of
Yeah.
peptide for the
Yeah.
joints, they talk about this being that better than. Now again, I haven't tried this, and so I'm so curious to go down that route to take care of my skin even better. But they're talking about this being better than HGH and stuff.
So it is pretty good. You can do an injectable, or you could do the cream with it. I even think they make an oral too as well. You can pretty much take these medications in almost every transportation method that you could think of. But yeah, so we do use it.
What would be the difference between a cream and a tablet?
So a cream that you're applying directly on, right? Which is pretty good. Absorption rate of what you're taking in. So I've got a little bit of hair on my arms, or maybe an injection is probably going to work the best because of the highest absorbency within. With a cream, you're going to absorb through the skin and apply on. Now, depending on the blend of cream that you get, because usually you're not just going to get it by itself. Usually you're going to pair it with a couple different things. And at that point, when you do pair it with those couple different things, some places that you might want to apply it on the skin because it's going to help the skin rehydrate and such. But as far as that medication directly, that's where injectable is probably going to be the best. And there's other health benefits that come along with it too. And then you have the oral version. So the oral version is probably about 60%, 70%. And injectable is going to be pretty much higher as far as what you're absorbing in and going through, because we talk about oral supplementation in any way, shape, or form. It's going to get broken down in the gastro tract. The liver's still got to process it through. And at that point, that's what you're getting out of it. So, with this, you can apply it, you can inject it, or you can take it orally. It's really up to the patient how they want to do it.